Tissues. A tissue, a grouping of cells that are similar in structure and perform a common or related function. B histology, the study of tissues, requires a microscope. C. 4 basic types. 1. Epithelial tissue, epithelium. 2. Connective tissue. 3. Nervous tissue. 4. Muscle tissue. Tissues. D. Epithelium. 1. Functions. A. Protection. B. Absorption. C. Filtration. D. Excretion. E. Secretion. Tissues. 2. General categories. A. Lining and covering epithelium. B. Glandular epithelium. 3. Characteristics of epithelium. A. Cellularity, almost entirely cells. B. Polarity. 1. Apical border. Tissues. 2. Basement membrane. C. Connective tissue support. D. Innervated but avascular. E. Highly reproductive. 4. Classification, many types named according to the number of cell layers and the cell's shape. Tissues. A. Number of cell layers. 1. Simple. 2. Stratified. B. Cells shape. 1. Squamous. 2. Cuboidal. 3. Columnar. Tissues. C. Types of epithelium. 1. Simple squamous. A. Lines the systemic capillaries, glomeruli in the kidneys and alveoli in the lungs. B. Filtration, absorption and secretion. Tissues. 2. Stratified squamous. A. Non-keratinized. I. Lines the mouth, esophagus and vagina. 2. Protection. Tissues. B. Keratinized. I. Makes up the epidermis of skin. 2. Protection. 3. Simple cuboidal. A. Found in the kidney tubules and secretory ducts of small glands. Tissues. B. Secretion and absorption. 4. Simple columnar, may be ciliated and contain goblet cells. A. Lines the majority of the digestive tract. Tissues. B. Absorption, secretion of mucus and enzymes, propulsion. 5. Transitional. A. Lines the ureters, bladder and parts of urethra. B. Can be compressed without damage, providing protection. Tissues. 6. Pseudostratified columnar, may be ciliated and have goblet cells. A. Found in portions of respiratory tract, trachea and bronchi. B. Secretion and propulsion of mucus. Tissues. E. Connective tissue. 1. Characteristics. A. Common origin. 1. Mesenchyme B. Varying vascularity. C. Extracellular matrix. Tissues. 2. Structural components. A. Ground substance, fills space between cells and contains the protein fibers. B. Protein fibers, provide support and flexibility. 1. Collagen fibers. 2. Elastic fibers. 3. Reticular fibers. Tissues. C. Cells. 1. Fibroblasts, connective tissue proper. 2. Chondrocytes, cartilage. 3. Osteocytes, bone or osseous tissue. 4. Hemocytes, blood. 5. Adipocytes, adipose. 3. Types of connective tissue. Tissues. A. Areolar, loose, connective tissue. 1. All 3 fiber types. 2. Most widely distributed CT in body. 3. Serves to hold organs together while allowing movement. Tissues. B. Dense regular connective tissue. 1. Collagen fibers dominate, very strong. 2. Run in a parallel arrangement. 3. Strength dependent on direction of force. 4. Forms tendons and ligaments. Tissues. C. Dense irregular connective tissue. 1. Collagen fibers dominate but in an irregular arrangement. 2. Strength in multiple directions. 3. Dermis of skin, joint capsules. Tissues. D. Adipose, fat, tissue. 1. Scanny matrix. 2. Highly vascular. 3. Serves protective function, cushioning organs, prevents heat escape, energy storage. 4. Underskin, around kidneys, and breasts. Tissues. E. Cartilage, 3 types. 1. Hyaline cartilage. A. large number of collagen fibers. B. Chondrocytes within lacunae. C. End of long bones, nose, trachea and larynx. Tissues 2. Elastic cartilage. A. Almost identical to hyaline but with increased elastic fibers. B. Support with great flexibility. C. Outer ear and epiglottis. Tissues 3. Fibrocartilage. A. Alternating rows of chondrocytes and collagen fibers. B. Has great compression abilities and resist tension. C. Intervertebral discs and menisc of the knee. Tissues F. Bone, osseous tissue. 1. Similar to cartilage in structure but more collagen fibers and the presence of calcium salts, make bone hard. 2. Osteoblasts and osteocytes in lacunae. Tissues G. Blood 1, matrix equals plasma. 2. Fibers are soluble and seen only during clotting. 3. Functions in transport and protection. Tissues F. Nervous tissue 1. Neurons, generate and conduct impulses. 2. Neuroglial cells, neuroglia, non-conducting cells. A. Provide support for neurons, tissues. G. Muscle tissue 1. Composed of muscle fibers, cells, containing myofilaments or protein fibers that function in contraction 2. Functions primarily for movement 3. 3 types. Tissues A. Skeletal 1, striated, striped, appearance 2, multinucleated. 3. Voluntary. 4. Makes up all skeletal muscles. Tissues B. Smooth 1, non-striated, appearance 2, mononucleated. 3. Involuntary. 4. Found around the hollow organs and structures of the body, except heart,